Coronavirus has posed an unprecedented challenge for humanity globally. 2020 has seen the introduction of social distancing, self-isolation and shielding. All words we'd either never heard of or used before in our daily lives. And all over the world, we are continuing to see the devastating impact of COVID-19. In response to the worldwide pandemic and to help reduce the pressure on our NHS and the spread of the virus, businesses temporarily closed and many stayed home to save lives. Throughout this, you all worked incredibly hard to provide the best possible service to our communities during this unparalleled national health emergency. Your ongoing dedication and commitment during the initial response has laid the foundations for the way we will continue to deliver our services to the people of Royal Berkshire. While we are all adjusting to a world with COVID-19, not a world after COVID-19, we want to take the opportunity to reflect on our collective response that is not just bigger, but completely different to anything any of us have experienced before. On behalf of the service, your communities and your colleagues, we want to say thank you for your outstanding public service. This is our COVID-19 story so far. As coronavirus developed, along with the severity of what this meant for our daily lives, we had three very clear areas of focus. Maintain our critical core services for the people of Royal Berkshire. Protect the health, safety and well-being of our teams. All while doing everything we can to support our partners through this unprecedented time.
Our staff responded really quickly to deliver our core services in light of the COVID-19 restrictions. One of the first things that we did was to limit any non-essential face-to-face contact in order to protect our residents and communities as well as our staff. After that, we moved to a risk-based process for delivering our core services, and we only delivered face-to-face activity when the risk of fire was greater than the risk of COVID-19. Our prevention teams moved to telephone delivery and they began doing telephone assessments and advice. And our prevention teams also began delivering online training to our local partner agencies who we knew would be working with the most vulnerable people during the pandemic. Our protection teams worked to a programme of remote audits and information gathering. We were able to use our social media channels and also our website to proactively deliver fire safety messages to both our residents and communities and also local businesses in order to make sure that we kept people safe.
As an emergency service, we were faced with a unique set of challenges, with a mixture of staff continuing to work on fire stations and in Thames Valley Fire Control Service, while many were working from home, in line with the government's advice. In light of this, it was a priority to support everyone's well-being through this challenging time.
The health, safety and well-being of our teams is always really important, but we quickly realised early on that we'd need to provide some enhanced and tailored support to take account of the impact of COVID-19. So we provided guidance and information on a range of areas, including working from home, bereavement and domestic abuse.
In recognition of the impact the pandemic may have on our health, we provided a number of well-being offerings.
We provided a lot of additional support for our staff during the COVID crisis. We offered a salary loan scheme for people that needed additional support. We maintained the pay of our on-call staff during the height of the crisis. We've offered free flu vaccinations to all of our staff to help relieve winter pressures on emergency healthcare. And we also provided accommodation to staff who were required to be in the workplace but were living with someone that was shielding.
The accommodation that my employee received was so valuable because as frontline firefighters we got involved a number of occasions with South Central Ambulance Service, actually dealing with patients who were suspected COVID-19 sufferers. So without this support in place, my individual employee simply would not have been able to attend the workplace and continue to shield his family member.
During this time, the service also took on a number of interns through the Leonard Cheshire Change 100 programme, which supports individuals with disabilities or long-term health conditions by removing any barriers in the workplace to allow them to achieve their potential. Joining a new workplace can often be a daunting prospect for anyone, let alone during a worldwide pandemic. So it was essential that everyone received the right support.
The service have been incredibly supportive throughout my experience as an intern. Right from the beginning, my team were very, very supportive. I've had a dedicated mentor to support me weekly with sessions throughout, and the team have also facilitated the interns to connect with each other and chat to each other and share our experiences.
While balancing the need to ensure that we maintained our critical emergency response services and the health, safety and well-being of our teams, we also supported our local communities and partners through the Thames Valley Local Resilience Forum. One of the primary areas of focus for our support was managing the critical PPE supply chain across the Thames Valley through the Local Resilience Forum's logistics cell. 7 members of green and grey book staff, with a mixture of expertise and skills, supported the distribution of 6.5 million pieces of PPE to frontline health workers to support the COVID-19 response.
PPE was really difficult to secure in the early days of the pandemic, so it was really helpful to have a coordinated group that was reviewing systematically what was needed and how we might support each other as partners to a system in securing and meeting that need. It also meant that it was a really good forum for us to share issues and also escalate issues as necessary.
In addition to the support we provided to the Local Resilience Forum, we also received requests to support our partners through local relationships.
During the COVID-19 pandemic, we supported Slough Borough Council and we were given a list of addresses where we could go and visit the vulnerable and people that were shielding to go and check on their general welfare. So we made sure that they had enough food, they were getting the food that they needed, and that they had family around to support them, and if they didn't, then suggesting other ways where they could get support.
Personally, being able to offer support to Slough Borough Council and their shielding residents was really important to me because some of the people we visited hadn't seen people for weeks. So just to see how they reacted, seeing somebody at their door actually caring and asking what they needed was really important to me.
The Fire Rescue Service really worked closely with the council. The council was supporting just under 5,000 shielded residents, and we managed to contact most of those people except about 250. And it was really important for us to have a trusted source, a uniform presence knocking on the door where residents felt safe, and that's what the Fire and Rescue Service did for us. They knocked on those 250 doors for shielded residents we were unable to contact.
It was really important to us as Royal Berkshire Fire and Rescue Service that although we're doing our day-to-day service as per normal, through the coronavirus pandemic we could step up to the challenge of the changing need and react to what Slough Borough Council on this occasion needed us to do to help. We can do more than just our normal day-to-day to help, no matter what the situation may arise, and we're very glad to do so.
The COVID-19 pandemic has posed some significant challenges to our way of living and working, and our teams have shown immense dedication and commitment. While our teams have worked hard to continue to deliver our critical services, they've also marked some key milestones. This included the opening of Crowthorne Community Fire Station, celebrating 5 successful years of Thames Valley Fire Control Service and receiving the Armed Forces Covenant Gold Award. We also consulted on the proposals contained within our Integrated Risk Management Plan, Prevention and Protection and Response Strategies, which shape how we deliver our services to the people of Royal Berkshire. This was all while welcoming new members of staff, which included 24 new whole-time firefighters who are now on fire stations serving their communities and taking on talented interns through the Leonard Cheshire Change 100 programme for the 4th year running. By working together and supporting one another, we've all been able to play our part in supporting our communities and partners through this immensely challenging time. Your courage, commitment and resilience has been nothing short of extraordinary. Despite the social distance put between us all, we have all used this time to strengthen relationships, say thank you and be kind to one another. I'd like to offer my heartfelt thanks to every one of you for the work that you have done and are continuing to do during an unprecedented moment in history. Thank you.